Hello, everyone. Welcome to Sexual Violence and LGBTQ plus Identities, Perspectives and Insights. My name is Johanna Durazzi. I use pronouns she and her. I'm the LGBTQ plus outreach advocate for Center for Family Services. I'm the vice chair of GLSEN Southern New Jersey and the chair of the New Jersey Coalition to End Domestic Violence LGBTQ Task Force. Our first panelist today is Ashley Riker. Ashley is an LGBTQ plus advocate, equity and inclusion facilitator, and program developer. Ashley is currently the Director of Diversity and Inclusion at RWJ Barnabas Health Community Medical Center. Our next panelist today is Bianca Mays. Bianca uses pronouns she or aya. She is a dedicated public health advocate who uses her expert knowledge, expertise, and skills to dynamically facilitate on race, gender, sexuality, and health disparities through a Black feminist praxis. Bianca currently works at Planned Parenthood Federation of America and is the Associate Director of Health Equity. Our next panelist is Rocio Cruz-Olivera. Rocio is a licensed professional counselor dedicated to providing compassion-driven services to survivors who have experienced sexual violence in their lifetime. Currently, she manages state and federal grants as well as oversees the programmatic functions of the Hudson Community Sexual Violence Program. Finally, we have Maria Parmagos. Maria leads the Hudson Speaks Coalition. She is a trainer, educator, and she collaborates with different agencies on sexual violence, consent, gender equity, and Hudson Speaks services. Our first question for this panel is, how do stigmas and stereotypes of the LGBTQ plus community contribute to the high rates of victimization and rape culture?
To answer this question, I'm going to bring it back to Hudson County and the communities we work with. When we talk about stigmas and stereotypes, especially for LGBTQ community, we mostly see youth being heavily affected by this, and also BIPOC, Black trans women as well. In our county, the rate of homelessness for youth is significant. The rate to have access and adequate healthcare is minimum to none. And with these stereotypes of LGBTQ youth and our healthcare systems and systems that perpetuate these binary, cis hetero norms really affect folks coming forward, especially if experiencing sexual violence in their own lives. And when youth especially come forward to receive services, especially for us from Hudson Speaks, a lot of the times what is told to us is these systems such as, healthcare systems, legal systems, and, justice systems are not really transparent or even inclusive in including them in pursuing, justice or health initiatives. So for Hudson County, it's really imperative to really meet them where they're at and try to fully be transparent and have adequate access for LGBT people, in our community, especially for BIPOC trans folks as well.
Thank you, Maria. Bianca, may I ask you the same question? How do stigmas and stereotypes of the LGBTQ plus community contribute to high rates of victimization and rape culture?
Sure. So when we're thinking about curriculum, right? We have to think about the people that create the curriculum for sexual health, for healthy relationships, et cetera. And very often people that are creating the curricula are not within the LGBTQ community. And so they are bringing their own biases to the curriculum and contributing to the stereotypes and the stigma around the LGBTQ community. We also have to look at media as well. Very often when we're looking at sexual violence, it's often depicted to be a cisgender male as the perpetrator and a cisgender female as the victim. And we know that it's much more complex than that, and that people are identifying themselves within the LGBTQ spectrum as well as being more gender variant. And we need to be more inclusive of the different kinds of relationships that people can have. And I think that in order to really debunk a lot of these myths and attack these stereotypes, we need to be more explicit in our education efforts, as well as making sure that when we have policy, that we are being as gender inclusive as we can when it comes to protecting victims. and making sure that in the school systems that we also have appropriate lesson plans where people can see themselves reflected as the different kinds of relationships and gender identities that exist, that we know exist and have existed for a really long time, which leads me to think of, you know, the binary perceptions that we have here when it comes to rape culture. For those of you that aren't familiar with binary perceptions, binary meaning in our society, very often we are subscribed to the narrative that there's only two genders, therefore the gender binary of male and female. And we teach through this lens, right? Very often we're thinking human sexuality, we're being taught the male reproductive system, the female reproductive system. We're being taught very exclusively about male gender roles or female gender roles, and not really leaving room for people that are androgynous or people that have no gender whatsoever. And so when we narrow the lens on what rape culture looks like through a very binary lens, then we're not able to see and measure what it looks like outside of the stereotypical cisgender, affluent, masculine male and a feminine, female identified victim.
So to kind of follow what Bianca shared, I think one of the pieces when we're looking at this from a youth perspective is this kind of over-sexualization of LGBTQ people or youth, and this expectation or this misconception that LGBTQ folks or folks who figured out that they don't exist as heteronormative or heterosexual, that they are supposed to or absolutely engaging in sexual relationships, or there's assumption that they should be. I know that when we think about the over sexualization or expectation of our young people to understand these dynamics without what Bianca shared, which is this comprehensive education and having a much more broad, a broad understanding or beyond the binary understanding of who people are, it is very, very difficult to be able to make those connections and keep our young LGBTQ youth safe. It is not a one size fits all supportive perspective. It is hospital systems, it is educators, right? It's communities, it's everyone working together to do this work. So.
And if I could just follow that, Ashley, that comment, you know, I'm also in agreement with that. I think, you know, when you talk about the binary systems and the traditional systems that the help and the supportive systems are based on, it does exclude the LGBTQ community, and there's not a lot of services, and even in the counseling field, right? A lot of theories and systems are not available or helpful. So it leaves the LGBTQ community feeling alone, and we do need to do better, right? We need to figure out how we can make this community inclusive, and how we can bring it into the youth, and how we can bring it into the school systems, and how we can now tie that gap, because you know the rates are high, but because, right, we're seeing it only in a traditional sense, we're excluding so many numbers, so many rates, so many, you know, so many statistics are not being mentioned, and there's so much help that's not being accounted for. And so, you know, I think that what Bianca and Maria also had mentioned really just kind of, it hits very close to this, that why it's just such a big contribute to rape culture. Why, you know, we don't really talk about it. The school doesn't really talk about it. You know, in our program, Maria has such a hard time going into the schools to even bring these curriculums, because the school systems still have a hard time wanting to even have these conversations. So, you know, I guess that's just further down the line, but yeah, just wanted to kind of throw that in there as well.
Thank you for bringing up those systems of care, because it leads me to the questions of what barriers to accessing those systems of care, such as hospitals or sexual violence services. What barriers exist for LGBTQ plus survivors, specifically with intersecting or marginalized identities?
Okay, so in my experience with providing direct service to survivors of sexual violence, a person undergoes many barriers and scrutiny just to report the crime, and then to seek services, and then to heal, right? But LGBTQ communities are often stereotyped and judged at a higher level, which then adds an additional layer of unwanted barriers. So some of these barriers that also intersect with the LGBTQ communities and survivors include those living with disabilities, person of color, elderly, non-English speakers, undocumented immigrants, those struggling with citizenship status, substance abuse, those in recovery. And those are just to mention a few, right? And these are layers of oppression that can deeply influence the ways that, individuals experience sexual violence, because that's just a wide spectrum, right? Not everyone experiences sexual violence the same. And so these are also limit options, in the way we limit, our systems of care. They're not all the same, and they're not always accessible for everybody. So they are very limiting, and these barriers are very intersecting, and they're not always, available for everyone, which is unfortunate. Because when we talk about intersecting, that one person who's disabled is also a person of color, is also LGBTQ, is also blind, is also undocumented. So all of these things, maybe one person is not eligible for a certain type of insurance or a certain type of assistance. So, we do need to have a better system to have these supports available for survivors. But I do also want to mention the historical factor of why so many survivors who identify as LGBTQ have a barrier, a very big barrier of not wanting or seeking services. I haven't been treated with compassion and understanding by social systems, not treated by compassion by the medical system, by the law enforcement, by mental health, by legal, by education, by rape crisis centers. So these are barriers that have caused a lot of mistrust in the past. And, these are things that we are currently working on dismantling. And so obtaining medical care and forensic exams are, they need to be more inclusive. They have a lot of work to do. They need to work on being non-judgmental. Part of our program, we go out there with our survivors and we accompany them for forensic exams. And, a lot of our work has to do with helping our survivors get through this process, because a lot of it is helping them not feel judged, helping them feel, supported, because there's so much of that needs to be dismantled, like I said. So I think that's also part of a big barrier. It's just dismantling the oppression, and why it's so important to continue that, especially in our transgender communities. So that's why I feel that that's a big barrier.
So I can also follow up, from a larger hospital system perspective. There are many hospital systems that are just in the process of starting to think about collecting information like sexual orientation and gender identity data, asking appropriate questions around gender identity and gender expression, figuring out ways to document that from a system perspective, to be able to, one, understand what someone might need coming in, and then two, affirming who they are, right? So when we start to think about the basics of affirming somebody's sexual orientation, gender identity, or gender expression, along with all of the other things that were just shared around those intersections of who people are, right? We are in the process, right, of trying to think about how then do we have these conversations, collect this information to be able to support this person coming in who's just experienced trauma, or who's just experienced a situation that is already problematic to talk about, is already could be challenging for this person to engage with. And then have that barrier of distrust around medical care and provider, what a provider has done in the past to them. We're not talking about accessing basic medical care, something benign that you can walk in and have a conversation about. You're coming in to get care on something that is extremely difficult and challenging to be able to engage with. So I think, it's twofold from a hospital perspective. If we're talking about those kinds of systems, it's one, having your staff, whether those are physicians, nurses, physicians assistants, the folks that are engaging with folks as they walk into, let's say, an emergency department, being well-versed. And it's not just about being well-versed in LGBTQ identities or being inclusive, right? It's being well-versed about the dynamics of relationships, not having this binary view of how rape or rape culture perpetuates, but really having that clear understanding. But two, you can have all of the trained physicians and nurses and folks in your system of care, but if the community that is experiencing this does not trust that they can walk into your doors, that will be a moot point, right? So building relationships with marginalized communities, and in this case, we're talking about the LGBTQ community and the intersections of the LGBTQ community. Having the best training on the planet is not going to help if folks are still afraid to walk in the door, right? So it's really twofold. It's thinking about both those internal and external pieces of what make people comfortable and creating safe environments to have these conversations. As we move through, and systems are just beginning to do this. I know at RWJ Barnabas Health and Community Medical Center, these are conversations we're constantly having. How do we do better? How do we learn more? How do we put policies in place so that we are not setting folks up to be re-traumatized? And it's a process, and folks need to start thinking about this as they continue to do this work.
Thank you, everyone. We continue to talk about an intersectional framework. And so I'm wondering explicitly why. Why do we need to use an intersectional framework when understanding the sexual violence experienced by members of the LGBTQ community?
I think it's really important, now more than ever, thinking about the past almost 2 years that we've had in this pandemic and the upward tick in racial reckonings throughout this country, that there's a lot of work to do. And it's not just the sexual health field or domestic violence field or public health. It's every single institution that currently exists in this country is about 100 years behind at the very least. And we know that we have to be intersectional, right? When you have people with multiple identities, to ask someone to leave one identity at home so you can focus only on their LGBTQ status or focus only on their race is harmful. We have to think and challenge the industry that there is no such thing as a one kind of approach for everyone. You can't do it. It simply cannot be done. When you're looking at it from an equity standpoint, it's impossible. Right. And we also think about how the ways that oppression is connected. All oppression is connected. Thinking about the entire experience and livelihood of a person, thinking about what makes people more likely to be at risk. We're thinking about large scale issues like poverty, lack of education. We're thinking about people that don't have a secure or a safe home. These are all large systemic issues that have to be addressed, in addition to, of course, advocating for more equality, advocating for better policies. We all have to make sure that we're doing our part in having an intersectional lens and a broader way of thinking, because very often these procedures, these policies, these standard operating practices have been in place for a long time and they don't match 2021, right? And we need to make sure that they do. And there's a lot of issues that specifically, uniquely affect BIPOC people, so Black, Indigenous people of color. When you're thinking about the cultural context of sexual violence is important, so important, because, and I'll speak for myself, I identify as Black. There are cultural contexts in the Black community that are unique in sexual violence that do not exist in other cultures. And I'm sure other identities and ethnic groups can say the same thing. And so we have to be mindful when we're planning education efforts, when we're thinking of interventions, we need to be as inclusive as possible and have multiple strategies to be able to address all of these different aspects of a person, because we know all of these systems of oppression are connected and that they each deserve, I should say, recognition, funding, support, and advocacy work around that.
I'm going to chime in. I want to say thank you to Bianca for highlighting a lot of the key points that we're especially seeing today in 2021. And I think a lot has to do with social media. A lot of social media has been really great for LGBTQ people and for our society to really understand personally what folks go through. But also it really shows a lens where we see a lot of heteronormative binary, stigmas and stereotypes still in place. I know there was a TikTok recently, if we're keeping it very 2021, a TikTok recently where a Black woman who is presenting as a female but has very androgynous features was speaking about her experience with sexual harassment with a fellow male identified person. And she said that since she presents as female but can be on the spectrum of androgyny, where she can pass as male or female depending on the day for them, that person was asking, are you a boy or a girl? And she said in response, well, why does it matter? And the person kept repeating, are you, a boy or a girl? And her response to this experience via TikTok said, when males or male identified people need to figure you out and put you in this box, okay, is this a female body person? Okay, let me go forward and verbally harass this person just based on having a female body, right? So when we talk about intersectionality, especially I always bring it back to youth because I feel like youth are very vocal and really want to see a lot of change. Having these gender identities or, things of that nature. And we talk about intersectionality where, if youth were to come forward to receive health services or to receive mental health services or to receive any services, legal, things of that nature, kind of like what you said, Bianca, to kind of like take those identities home. Okay, I can't present this way, but I have to present this way. I can't verbalize that I identify this way. So I have to exclude that, because if I do identify this way, then I might not be able to qualify for certain things, right? So really having our systems, which is all based on, white supremacy, colonialism, and oppression, it always goes back to these binary constructs that were made to put certain people in power, right? And when we talk about intersectionality, it's really complex, but it can be very simple by having inclusive language, by having appropriate conversations, especially with medical staff, staff in the legal systems and justice systems and things of that nature, with intersectionality, because each person is very unique in experiencing sexual violence. A white identified or cis-passing person can experience sexual violence very different from a BIPOC person, right? And then add another top of layer of identifying as LGBTQ, right? So there's so many layers of oppression that someone could walk into a system and not receive the adequate or proper services because of their identities. And to kind of circle back into our, anti-sexual violence prevention work, a curriculum that I present in the county called Media Literacy, we have an exercise called the gender box, right? And, when we write, what is it to be a man? I'm going to use air quotes. What is it like to be a man? And what is it like to be a woman? And we ask participants, what does that mean, right? We have a lot of feminine mannerisms, or physical body types or how they're supposed to talk and act and walk, right? So it's already programmed. We've been already taught from such an early age that a woman is supposed to be in this type of box. And if she is not, then, you know, I don't want to be very explicit, but not so nice things are already said about that person. And if a person identifies as male or as a man, and, you know, in this box, you know, he has to be strong and, you know, assertive and, you know, breadwinner. So there's so many different words and attributes that's already connected to this person based on gender and these roles, right? And if they're outside this box, then there's, you know, consequences for being a man who's not really a man enough, right? So when we talk about intersectionality and gender norms, you know, they've been in place for such a long time, and to really have people think outside the box, right, can be difficult. But I think, you know, having conversations like this or with other professionals in our communities to really talk about what is the needs of our survivors, especially who are identified LGBTQ, excuse me, is so important and so necessary, because it's not just about cis people. It's really not. There's so many different types of people identify in so many different spectrums that are not getting what they deserve and they should.
Maria, thank you so much for bringing up that TikTok creator. I actually watched that video probably 30 or 40 times. And the part that really got me when listening to that creator's, the end of that TikTok, was that this person said that the person that she or that they were talking about essentially was waiting for them to validate his sexuality by answering the question as to whether this person was a boy or a girl. And they said, you know, I was essentially in a position where I could, the onus was on me to keep myself safe by answering this person's question. And they described his behavior as almost like a catcall, like a expecting a response. So it really got me there that this content creator said, I was responsible for his sexuality, his sexual orientation, his attraction, and my safety within the 30 seconds of this interaction. So we think about this context and all of these factors as it associates to safety. This content creator said all of it in 30 seconds or 45 seconds of this TikTok, that this is what it's like. This is what it's like. This is how it happens. It happens, right? Being at risk, ending up in this situation without any other risk factor except being in the world, right? Just existing. So thank you for bringing that up, because it definitely was, social media has been super impactful, and that particular content creator was really powerful in explaining those dynamics.
Thank you all. So taking into consideration this, the importance of the intersectional lens, the understanding that different barriers exist for different individuals that are experiencing different types of things while identifying similarly, right? Like, you know, the way that a white identified survivor that is LGBTQ can experience different avenues of oppression than a Black, Indigenous, person of color, or a BIPOC individual, right? So taking that intersectional lens into account, how can service providers better serve all LGBTQ survivors? What transformative changes must be made by current systems of care?
I think firstly, we can always go back to basics and have, you know, a lot of our systems require certain paperwork, right? If we have inclusive language, options for identities on their preferred names. You know, I think like a lot of these essential things really do make a difference. And, you know, to bring it back to a personal experience when working, you know, for me, I'm always going to bring it back to youth because I love the youth. Bringing it back to, you know, inclusive language and options when doing programs such as Media Literacy, like I mentioned earlier, on like the pre-test form, I asked for preferred names. I ask for, if you identify, do you want to listen? Do you prefer not to answer? So I try to make, at least for the work Hudson Speaks, at least what we do, and I hope it, transcends throughout the communities, to make sure that language is inclusive and make sure you have options for folks to choose. And it's not always just male, female, do not answer, right? And also talking about systems in place when we talk about healthcare, I feel like, Rocio mentioned earlier of having, our hospital systems and healthcare systems, you can be trained to the umpth degree, like Ashley mentioned, but it's just putting those into practice, having to constantly affirm someone when they walk into the door and saying, this is what happened to me, I need help. Then your personal biases need to leave and walk out that door and make sure you have that time and space to really affirm the person who's in front of you requesting these services, right? So I feel like we can always start off with the basics of just having, our websites inclusive language, or having our paperwork with inclusive language and options, how we speak to our clients or families, even to our colleagues who identify more inclusive, really makes a difference. And to really affirm someone of their experience and them coming to you for, help, believing the person when they tell you of something happening to them, especially if it's assault, and all these other factors really come into play when someone is being vulnerable, right? And we as service providers, or we as professionals, really have gatekeeping a lot of things where we can really withhold a lot of information, or we could withhold services based on someone's identities, but we're doing a disservice to folks who are in real need, especially when it comes to sexual violence.
I also think it's really important that when we're thinking of being inclusive, that we start breaking LGBTQ apart. And I say this because cisgender, lesbian, gay, bisexual people are going to have different needs than someone that's trans or non-binary, and we need to definitely be more explicit in doing that. We also need to make sure that we have interventions in different languages, right? There's no reason why we should still be only having resources in English. We know that there are different languages that are soon to become the more popular languages of this country. So we definitely need to start doing that as well. I would also suggest start talking to these communities, like have a focus group with Black queer people, have a focus group with Asian or Pacific Islander people, right? Because again, you need to start thinking and looking and experiencing these different groups on their own, and not just thinking same intervention for different population groups. And then I would also say, as any organization should, start participating more in race equity. Start explicitly naming how white supremacist culture and systemic racism shows up at your agency, because they show up at all agencies. Some agencies have been around for at least 100 years. That means that at some point, white supremacist culture was a part of that. And so it's okay to name that. We're all doing this together. Every system, each nonprofit or for-profit, even hospital culture is now adapting itself to race equity. So I would definitely say that is a huge component, in addition to making sure that you are asking the right questions for sexual orientation and gender identity of your client.
So chime in, Bianca, you brought up kind of breaking apart the LGBTQ plus community and really focusing on the experiences of people of trans experience and those who are non-binary. So I think it's also essentially important that when we're talking about the actual care, when they come in, if a person of trans experience has had a gender affirming surgery or is receiving cross hormones, or has transition related care, medical care, we really need to think about being careful with who they are and what they've experienced already. Not just simply saying, hey, this is how we do the exam, this, cis expectation or cisgender bodies, we need to be aware of the wide range of the way folks experience their bodies, and the trans and non-binary community may have differences that folks may have never engaged with and can create even greater barriers. So really thinking about the training from what Bianca said, from the expectation of the actual care provider, the clinician, that is exceptionally important as well. Just simply saying, hey, folks of trans experience or folks of non-binary experience, this is how you should engage with them, but it's really about what happens when you're physically providing the care as well. That's super important to remember.
Okay, and my last question for you all is, how can we better support LGBTQ plus survivors as a society, right? Like not even just in our particular programs, but overall, what should our prevention efforts look like in that being conducive to a transformed society?
Hey, so we have to start also by being better allies, working on examining our own biases, and really addressing them, and working on, just examining our own cultural competence, and realizing that this is a lifelong journey, right? It requires like ongoing education and resources, and just kind of an understanding of like our own biases and how that comes through in our work. And for me as a counselor, I don't want survivors to have to educate me. I want to do the work, and I want to do it not only for myself, but also because it's not their job to have to educate me, right? So I think it's an ongoing educational journey for me as a professional, as a parent, as a as a human. And I think being an ally, working with communities, collaborating with organizations, grassroots organizations, as Bianca mentioned also, on doing racism, working on organizational and systems, and really just addressing a lot of these questions that have been on everyone's mind. I think that's really kind of where I feel that we can better support LGBTQ and plus survivors moving forward.
Start inviting LGBTQ survivors into your agencies, into your education efforts, to share their experiences with clients, with youth, with community. I think reflecting on my own experience with sexual violence in a queer relationship, that if I had seen someone like me full front and center talking about their experience, I would have been able to identify myself a lot earlier or younger as a survivor. And I think that very often in these spaces, we have to think like, who's not at the table, and how do we start extending a hand to them so they can be a part of the decision-making process? Because very often the communities we serve are not in the room with us when we're creating content. They're not in the room with us when we are, at these conferences, or not in the room when we're thinking about how we can do better with our services. So I definitely think that we need to start inviting them more into this space to share their experiences of violence, but also their experiences of receiving services from agencies, so that we can adapt and do better.
There's also another important part that I missed. It's just continuing the work on bystander intervention, like just working on teaching the community on bystander intervention, the youth, on how to respond when kids make these inappropriate comments, and how to protect one another, how to stand up for one another, and really stopping the cycle of abuse, and stopping the cycle of just continuing to hurt one another. And so I think Maria does a wonderful job in her role as outreach. We're working with colleges and really presenting on bystander intervention strategies, working on campuses and schools. And I think that's somewhere we continue to do our work, and that's somewhere we want to continue our efforts in. And so that's another aspect of our job where I'd like to see that moving forward.
Thank you, Rocio. I was actually going to mention bystander intervention, so I really appreciate you giving me, the little note. And also, I want to say, Bianca, thank you for being vulnerable with us. I really appreciate you, honor you for speaking your truth today with us as well. But also, in addition about bystander intervention, really having these conversations with our communities younger. A lot of people don't know even how to identify their body parts correctly, like proper terminologies. It starts at such a young age. And like, what Rocio mentioned earlier with like college campuses, and when we talk about high school, even middle school, having the proper education is really essential. Us as professionals, we didn't just come into our positions, know everything. It's not possible. So it takes a long time to really integrate and process and to really unpack our own personal biases, our own personal thought process, even our own cultural processes of what is LGBT in our families, right? So it's really about really undoing and unpacking what we have been taught, which is based on very binary, very cis hetero, white supremacist, colonial-based ideologies that have been impacting our systems for such a long time that now we're just chipping away bit by bit of really getting to the root of a lot of our issues when it comes to sexual violence and LGBT identified people. In addition to that, like Rocio said earlier, we're the ones that people are coming to for assistance or for help or for resources. So we need to do our part to really educate ourselves and to continue to educate ourselves to really make sure that the work and what we're providing for our survivors who identify on the LGBTQ spectrum really have adequate care. And if you don't have access, depending on where you live in your community, try to reach out to your local Pride Center or your local LGBTQ center. Their websites, I know for us as Hudson County, we work with Hudson Pride significantly, and we're really grateful for them to really provide education, their programming, how we can work better, smarter, not hard, as I like to say, and Rocio knows this too, how we can really have our clients feel comfortable of coming to us for services and vice versa, right? So I think it really starts with, not being such gatekeepers of, who we are as, these systems that fall into place when it comes to sexual violence and prevention work. Yeah, and with bystander intervention, it's just very crucial to really teach or to really educate our youth. I feel like are such a level than when I was their age of having access to information, especially social media. We were talking about TikTok before and things of that nature, to really make sure that if content is being produced, make sure it's accurate and of, with decency, right? Because there's a lot of content out there that's really still pushes the binary stigmas and the stereotypes still, which is unfortunate. But, having these educations of bystander intervention in place, I feel like will really, pivot us into a better direction when it comes to survivors.
Maria, I also think that when we're talking about educating our young people, sometimes we like to focus on educating our LGBTQ kids, right? Giving them all of the resources to learn about themselves and about people they see as similar to themselves. As a mom of 3 cisgender kids and a beautiful transgender daughter, or trans-identified person, making sure our cisgender young people have a real clear education understanding about who the LGBTQ plus community are, how they should be valued, connecting them to the norms of all young people, but also explaining the differences of intersecting identities. I know that for parents, I've spoken to more parents about being terrified about having this conversation with their kids about who they are, which then leads young people to kind of internally battle or struggle with things or make decisions or get themselves into situations that they don't have the knowledge to get out of, or and don't feel like they have anybody that they can go to. So I think educating families is also exceptionally important, and I think that's a much harder piece to do, right? But if there are folks who are willing to do it, if there are families that are willing to even listen for a short period of time, even if it's a TikTok video that is 30 seconds when somebody's scrolling through, that is accurate and is providing really good information, it may change the trajectory of the life of a young person. So I think education is key, but we have to really look at it broadly, across families, across communities, and then, all of our professionals that we work with.
Actually, if I could just chime in with you on that, I think you're absolutely right. I mean, I think working with youth is important, but with the parents and the families, just helping unraveling culture and unraveling, tradition and what is that? What does that look like? And kind of, helping the youth and the families kind of cope with changes. And I think just that in itself, right? When we talk about intersection, that's exactly what we're looking at, right? We're looking at culture and we're looking at generational trauma. So we want to look at all of that. And so I think it's so important to have those connections with multiple organizations to kind of help bridge that gap, because then we can reach out to for us, it's Hudson Pride. We can say, hey, what resources do you have for parents? We could reach out to any counselors that we know. We can reach out to schools to, and that's kind of how I think, it's so, I think that's how we can also help our youth and our families and, our society. And I think that's, that's such a great point that you brought up, because parents often are overlooked. As parents, I just want to say, I think it's important. And I thank you, Ashley, for bringing that up, because it is important to remember that we are the support network for youth as well. And they come to us to look for that support, and we need to be able to provide that for them. So yeah, thank you.
Well, before we close out, I would like to open the floor to just any last comments or sentiments in general in regards to LGBTQ identities and the way they intersect in providing care for LGBTQ folks.
I'll go. So for me, I just want to say I'm really appreciative of you and having this conversation with you all, and also for folks who are going to view this. I think having these continued conversations is so important and so essential to really dismantle and really do the work when it comes to survivors who identify LGBTQ. Also for me, as a personally and interpersonally, a lot of people I love and care for who identify and who are survivors of sexual violence, I know has impacted their life. And for me to do this work really means a whole much more, not saying than the average, but it just really makes me want to really propel forward and really make sure that the work that not only I'm doing, that the work shows when we're out in the community, really to create a healthy impact and to create a ripple effect of consciousness, and to really have folks critically think and just, realize that, a lot of what we have been taught has been, just not correct and just really deeming and just very limited. Not saying for folks who have taught us in the past, I don't know, they just didn't have the language or the certain vernacular to really express and understand and even teach us properly, right? We had to learn ourselves. So for me, the work to continue to do this work is very important, and especially for survivors. So I'm just very appreciative of this time and space with you all to really dive deep and really answer these questions truthfully and as providers and professionals. So it's really appreciated.
I would say bring queerness into all of your conversations. I know very often when people think of our community, they think of, June and Pride Month. And although Pride Month is very important, I like to tell people, people are queer 365 days a year. So it's really important that we do things outside of just June. Really dedicate yourself to the community. Be that person that has, the rainbow flags. Be that person that's advocating for recognizing awareness days outside of June. You know, November is coming up, December is coming up, January is coming up. All of these months are coming up, and there's plenty of awareness days and education days that you could tailor specifically on the sexual or gender minority group that it belongs to. So I want to urge everyone, like, there's plenty of more research to do, and it's not a one size fits all approach. Just because you received LGBTQ training a year ago or even a few months ago, it's always great to be up to date on the community because we're ever expanding and our lives are complex. And so the same way that you dedicate yourself to learning the foundation or the principles of sexual violence so that you can advocate for others, start doing that for LGBTQ identities and for race equity as well.
So when I think about everything we talked about today, you know, and I bring it back to the work I do in a medical or a hospital space, I think, you know, what those larger systems of care do well is things like developing those policies or having kind of standards of behavior around what we expect, who we expect our staff to be, how they're supposed to engage while they're caring for patients or with families, right? Or providing clinical care. But I think sometimes there's this fear about standing up and saying something when things don't fall within those structures or those systems that have been created to kind of keep everybody flowing within their work roles. So when we think about things like this, right? So whether we're talking about you know, LGBTQ issues, or we're broadly looking at race or race equity, or how that connects back to health equity, or the intersections of folks who identify as LGBTQ and you know, BIPOC, right? So if we're looking at that from a larger, grander perspective, being able to say and help folks learn what they are seeing, and validating that if they are seeing something that is problematic, or if they are seeing something that is not appropriate, or things that are occurring, that they have the ability to speak up and say that, and then something to be done, right? Not to simply say, hey, this is happening, but I don't have the capacity, or I don't have the I'm not sure what to do in this situation. Do I say something? We can't change systems. We can't create health equity unless folks are willing to say it out loud that these things are happening, and communities are experiencing trauma. They are experiencing the world differently than the folks that have those unearned advantages or the power and privilege. And we need to be able to be open to having those conversations. And we know in those smaller spaces, it might be easier to have those discussions, but in those larger systems, that can sometimes become limited, which kind of stops those changes from happening. So what Bianca said is, I mean, absolutely true. 365 people exist in who they are, and you can experience the world both positively, negatively, or you know, not at all, right? For folks who decide that what they've experienced is too much for them. So I just want to reiterate that being able to do this work collectively, but looking at how our system does this work, or larger systems do the work, is exceptionally important as well. We can't do this without all of us paying attention.
I like to just say that, you know, get more involved in your community, become an ally, identify your local LGBTQ agency within your town, your city, maybe hotlines, know your hotlines, know, you know, state organizations, know what's going on, what events are happening. You know, don't be afraid to ask questions. Don't be afraid to, you know, just attend an event and get to know your community members. You know, also learn about bystander interventions. That's a very sure way to learn how to support one another, to not only teach young kids how to, you know, not judge one another, and to not put down someone just because they, associate with another identity, or because they prefer another gender, or let's break down those barriers. Let's work together to just be better. And so I think by doing that, we have to look around us and learn the wonderful resources that we now have. I mean, this is a wonderful time to be alive. I mean, there's so many resources around. I mean, this group of women that I'm with now on Zoom, I mean, you all are so very knowledgeable. And so I'm thankful to be here, and I'm thankful to have this opportunity to be on this Zoom. And so, I just ask that we all continue to do our part, and that we continue to uplift and educate one another.
Well, thank you all so much for taking the time to educate each other, the audience, and I deeply appreciate everything that was brought to light today. It's such an important topic. It's something that is seen very commonly as almost like an extracurricular topic, and not something that's on the center stage in the forefront of our work. So I definitely appreciate this panel as a call to action to keep these marginalized identities, at the forefront of the work that we do, so that we can help create a society that supports all folks. For additional information about each of our panelists, their extended bios are in our program. Thank you all again for taking the time to listen to this panel, and I hope you have a wonderful day.
Okay, I see our first question. Do you see a lot of resistance when doing outreach and education? How do you deal with this resistance and power through it? That's a great question.
I can answer this question. So hi, everybody. Again, Maria.
Maria, we can't hear you.
Oh.
Maria, we can't hear you. Does somebody else want to go first?
I can go. Can anyone hear me? Okay. Hi, everyone. I will go. To answer this question, when I do education and outreach, I don't see resistance. I see misunderstanding. I think for a lot of people, we still need to make the case as to why we need to have lessons explicitly talking about queerness and sexual violence. How do I deal with this and power through it? I remember that there are victims and survivors out there, and that we owe it to them as providers to do this hard and necessary work. Because there is someone out there that doesn't know that these things are not supposed to happen to them, and they don't know where they can get support. And that lack of knowledge, to me, is what really drives me. And the fact that we're in a changing world. I mean, this world is becoming more aware of LGBTQ plus identities and how we show up and how we move. And I feel like as a queer person, I'm reclaiming my power and my time from people, and like really asserting myself at the table. And I think that's what really powers me through, that I want this to be an easier, better life for the next coming generation, and for those of us that are still here, right? I want to make sure that we are also covered and protected as well.
Absolutely. Thanks, Bianca. Maria, do you want to give it a try? I'm sorry, I don't know what was going on, but let's see if we can get it this time.
I believe some folks said they can hear me. So can you hear me now, Denise? Okay, wonderful. Okay, so yes, thank you for this question. So for me, this is kind of my realm, prevention, education work, and outreach. So the work that I do specifically in the county I work in, there's so many different things happening simultaneously that sexual violence and prevention comes up when it's a need, when it's happening at that moment in crisis, as opposed to having it being a collective form of education and prevention work that is given on a primary level, especially for me when I'm speaking is in the school systems. So, you know, sometimes I joke around, and Rocio knows this, that sometimes I feel like a car salesman with folks in these school systems where I have to pitch and have them understand where I'm coming from as a point of not only education, but just providing as a connected resources directly to the school to provide crisis intervention work, just in case if a student were to experience sexual violence post or on campus. So for me to really, you know, plea or to really exemplify that to have this education is necessary, healthy, and beneficial, you know, I do get a lot of pushback, and a lot of pushback is, you know, can we separate the rooms from boys to girls? And I always say, well, you know, everyone, you know, when they have class together, they're always with each other, even in classes, lunch, or even when they leave the school campuses. So getting pushback in that realm, or getting pushback of, you know, if you can only talk about consent, healthy relationships, but can you not really talk about condom use or things of that realm? It's like, okay, try to work with these schools or, you know, specific teachers or school-based teachers. But if a child or a young person or any person has a specific question, I'm not going to deny them. I will answer that question, because I could put myself in that person's place in these school systems where we were silenced or told not to speak up and ask these questions, right? So I'm not going to limit myself and my, you know, expertise to answer questions for, you know, especially youth who have curiosity and knowing about their bodies. What is LGBT? What is sexual violence? How does that relate, especially in communities of color as well? So for me, what I like to do is to relate to the person at hand and let them know that this information is correct. It's coming from a reliable resource, it's coming from a professional. And if we're to do extended education, it is given to parents, whether it's parent teachers night or even the staff training. So I try to make it as inclusive to everyone involved as possible. But it is, I'm always knowing in the back of my head, I know I'm going to get some type of resistance, but how to work with the person and not work against them. So, you know, my years of experience is, how am I going to make this relationship smooth? So not only benefits the systems at hand, but also helps us working directly with them, and then our clients or our survivors or our families. So that's kind of how I process and how I work with our communities at hand.
Thank you so much, Maria. And Rocio, would you like to add anything?
No, I think honestly, Maria hit it right on the so I'm fine. Thank you.
All right, so we'll go to our next question. We see in our work on legal restraining orders that fewer LGBTQ folks want to utilize the court system for protection. What needs to change to make the civil protection system more accessible and a more viable response for LGBTQ survivors?
Such a good question. I think first, the court system needs to continually receive LGBTQ training. I mean, our community has historically been harmed by the police, been harmed by the legal system, the court, judges, etc., served harsher sentences, stories and cases not believed. We were deemed inappropriate or sexually explicit or hypersexualized by these systems that are organized not to work in our favor. And I think a lot of conversation and training and education needs to be provided to the court system and to the community as well, because unfortunately, when communities are harmed, it's very rare we see, you know, coming across the aisle, like we apologize and acknowledge we treated you poorly. We want to be able to work with you better. And so people carry that historical harm with them, and they transmit that onto younger queer folk. Like, I've had queer elders tell me, like, I remember when I was assaulted and I told the police and they laughed. And like, they are telling me this, a younger LGBTQ person. And now I'm sitting here in my head like, wow, if I'm assaulted, I don't know if I would say anything, just based off of people that I know fully shown like, hey, I tried to go to the court system and they laughed at me, or they had requirements that I didn't necessarily have. I came in with my ID and they laughed at me and didn't support my gender identity, even though it wasn't reflective on my documents. And so I think there certainly needs to be a lot more accessibility within the system and for providing education as well. Also, there needs to be more education on anti-discrimination. Like, we're here in New Jersey, we have wonderful laws against discrimination, but that doesn't mean that people know that. Right. So a part of it is that you have to teach people like, hey, you cannot be discriminated against here in New Jersey. And like, here's all the reasons why, and here's how it applies to you. And so that also is something that needs to definitely be fleshed out a little bit better, in addition to other pieces of education that people are learning.
Yeah, and if I can ask, and I think that's like really great information, Bianca, because it's to further add from that, like just getting in touch with the legal resources, and like for us in Hudson County, like Hudson Pride is always up to date with legal resources as well. And any current legislator, whether it's federal or state, that's changing in regards to further supporting LGBTQ and just, expanding on what needs to change, in regards to protection orders, in regards to just, working with law enforcement or just in the legal system itself, whether it's additional trainings. And I was reading in one of the comments with Mary Smith with, in regards to the additional layers with regarding the difficulty that survivors encounter. That this is an ongoing thing, right? We're just talking about how we can maybe, the interrogation process, how we can make changes in this and in the language that we use, and how we can, start there, and how we can, incorporate more structured, trainings, and how we can add, bring in different agencies to these trainings. So these are ongoing conversations. I was just reading with Barbara with regards to the first responders and the community educators. A few years ago, back in pre-COVID, we did do a training when they actually invited our program to come in, and we had an opportunity to talk a little bit about what advocates do, to talk about trauma in itself and why it's important to bring in an advocate into the room when they're having a forensic examination, because law enforcement, they come in very black and white, just they want to get the job done. We're not really taking into account the trauma that comes into it. So, we're working on that layer, but let's bring in the LGBTQ and all the multiple layers that come with that. So it's really just kind of undoing all these multiple layers, and how we can, continuously see, how we could bring that to the legal table, and how we can work with other communities that are working on that, to make these changes happen. But it's big efforts. But I think we can start making these changes.
Thank you both. Do either of the two panelists want to add anything else? Otherwise, we can move to the next question. All right, we can move on to the next question then. Says, I do agree with everything you said, though practical implication of community education or first responder training or parents education is where the things can get complex. How can you convince your target audience, especially people on the conservative spectrum, that they actually need this education? How do you measure the impact of your outreach and your education efforts?
So hi, y'all. Sorry, I was having some technical difficulties getting in today. I would love to chime in on this question. I think when we begin to think about the lived experiences of our young people, especially around this topic, and the importance and the connections that parents or adults or important elders that young people have in their life, or support structures, right? Those larger support structures that have those conservative views around kind of broad identities or broad connections to sexual orientation, gender identity, gender expression, or some kind of other intersecting identity. We have to remember that even providing a small piece of information, whether that be introducing a topic like gender identity, even if it's a small piece of information, can impact some level of change. We can't always assume that people are going to understand the broad or the intrinsic nuances around someone's sexual orientation, gender identity, or expression, and how that connects to risk. But being able to provide some information based on those inroads to having those discussions can make people pause and begin to think. We can't expect to go from 0 to 100 when we have folks who have deeply held belief structures around their lived identities, whether that's religious or cultural. But I think being able to be brave enough to have the conversation, even if it's going to be uncomfortable for the person in front of you or uncomfortable for you, you are here to create or provide this lens of equity or this lens of support, even if it's not going to give 100% of what we want to see from those communities or from those folks.
Thank you, Ashley. I'm so glad you finally got on. I apologize for your technical difficulty. I don't know what happened. Anyone else want to add anything else to this question? How do we measure the impact of your outreach and education efforts?
Measurement is so hard. I was having this conversation earlier this week with other adjuncts around, like, how do we measure people taking away what we're talking about in the classroom? I think we were thinking of being more creative with it, because you can't really survey this, right? Like you can do a pre and post test. Are those effective? Kind of. I do like to have people demonstrate or summarize on their own the understanding of the lesson. I also like to include storytelling and testimonials too, like thinking about other ways and tactics of measuring. And then you can also, do the stereotypical looking at hospital admissions and public health admissions. But I really think that there's room and space for more qualitative measurement instead of just solely focusing on quantitative, because quantitative doesn't tell you the story. And we also know, like, marginalized identities are less likely to fill out quantitative measurement strategies, surveys, et cetera. So focus groups, going back into schools, follow up after you do an educational talk, like follow up and say, hey, where's this sitting? Did you end up using this 6 months from now? I think sometimes in education, we do a really good job of like delivering the information, but less of a better job of following up later on. Like, yes, evaluate as soon as you're done with the training, but also evaluate 6 months, a year from there to see if it's needed, necessary, needs to be adapted, etc.
So I'll chime back in and connect to what Bianca shared about the qualitative and quantitative part of this. I think when we are looking at things like measurement, like she shared, I think we are trying to prove that ... right? Prove that we've done this, we've provided that, right? But I think seeing a shift in climate or seeing a shift in accessibility or seeing those shifts based on the stories that are told and having that qualitative piece of things is essential. And you're going to see that look different in different environments. So if you're looking at this in a hospital environment versus a, let's say a health clinic environment or a community environment, the way and the access to how those stories are told is going to look different, right? It's not always going to be in a focus group setting. It's not always going to be, it might be at a table with your, with peers, and somebody shares a story and then that story is connective in that group. It may be among kind of affinity spaces. It may be among, right? It's not always going to be accessible in the same spaces where those stories are being told, because it's not safe always to tell your story depending on what identity you connect with and where that information is going to be shared, right? So thinking about the qualitative part of the story also has to do with accessibility to tell your story and safety, and creating those avenues for safe information sharing and safe storytelling. It's not always going to be a connective or cathartic experience for someone to provide someone else those structures of experience that they've had. And just know that you allowing for that access and seeing things more broadly, seeing the effective changes more broadly as incremental, not we have X amount of this, or we were able to share this many stories. No, that's really not what it could be. The impact of one story, not 25 stories. So thanks, Bianca, for bringing that up, because I think that is something we need to definitely think about when we're measuring our ability to create that change or support those folks.
Yeah, and I want us to, like, you're just making me think of all the things I was thinking of earlier. Like, we also need to learn to stop measuring things in ways that are convenient for the agencies. I mean, I was just talking to someone about Press Ganey, and they're like, are you going to be using Press Ganey? I'm like, yes, and we're going to create another tool for measurement, because there has to be so much more than just Press Ganey and Epic and all these other systematic things that exist out there, and they are helpful, but they don't tell the complete story. And I also want to be careful too, because just living as a person with multiple identities that are marginalized, you get tired of seeing X percentage of queer folk are more likely to insert negative thing here. Like, you get tired of seeing that and hearing that, right? Like, we get it, Black people are less likely to live longer. They're more likely to die of maternity. Like, we understand that, okay? So we have to move past that kind of measurement. Like, let's get a little more deep and nuanced and gritty with how we're getting that information, because those statistics have existed for a really long time, and there's still not interventions created to dismantle that, to attack it, to address it, to solve for those issues. And so we need to come up with better measurement strategies so that we can actually do something with that data that we're getting.
Wow. I feel like we could have a session just on that. I mean, it's just, it's so important, and it's so true, right? The way that we evaluate. But unfortunately, we're out of time.